Hi, it's Dr. Ho here. The topic I'm presenting today is the basics of wound dressings. The goal here is not to make everyone an expert on every single type of dressing out there, as there are number one, innumerable products in the market, and number two, the evidence for very specific dressings is quite poor. As such, this section is geared more towards the role of a PCP or hospitalist, and the objective is to provide you with the basic tools to initiate appropriate wound care. I'll be leaving products such as protease modulators, topical antiseptics, and the like for a future presentation for those who might be interested. More importantly, we should focus on addressing other factors of healing, such as ischemia, infection, and edema, as these ultimately take priority. The dressing should be the last thing on your list. However, the very critical aspect that appropriate dressings can be a large factor in is managing drainage. Drainage, of course, can make or break the entire healing process, so that's how we'll classify and determine which dressings are appropriate to use on which type of wound. Remember, dressings manage drainage. This table is a very truncated list of primary dressings, not including wet to dry or dry to dry regimens, which are sometimes favored by our surgical colleagues. Let's go over a handful of very basic topical agents as our primary dressings. Here on the left side, under the product column, I'm going to start with alginates. These come in sheet, rope, ribbon, and silver impregnated forms. The purpose is to absorb fluid and promote autolytic debridement. And the wound type this is most useful for are moderate to highly exudative wounds. The next product are honey products. These come in gel, sheets, strips, or gauze form. And they add moisture, they promote autolytic debridement, and are antimicrobial. The wound type most appropriate for this are the low to moderately exudative wounds. Hydrogels come in gel sheet, silver preparations as well. They add moisture, they promote autolytic debridement, and are used for dry to low exudative wounds. And finally, iodine. Purpose is to be antimicrobial and used on dry gangrene. So again, alginates, including calcium and silver, are used for highly exudative wounds. Honey is used for low to moderately exudative wounds. Hydrogel is used for dry to low exudative wounds, and iodine for dry gangrene. Let's talk about secondary dressings. This refers to what you use to cover the wound itself. They too differ based upon absorptive properties. Of course, there are companies out there that manufacture products like honey impregnated bordered foam, and then the cost goes up for convenience. We, however, will be discussing the basic dressings coverage to use for the primary dressings that we went over in the previous slide. Again, remember, dressings manage drainage. Keep this mantra in mind and it'll be easy to determine which of these three to use. The first type of basic dressing is border gauze. This is a piece of gauze with bordering adhesive for wounds with little to no drainage. Next up is bordered foam, which as apparent is for wounds with moderate drainage. And finally, the ABD or abdominal pad plus gauze roll and tape are for large drainage wounds or large areas of coverage. Dressings manage drainage. Don't forget, instruct patients on how frequently to change their dressings. For example, wounds which are fairly dry, you could use honey gel and bordered gauze, change every other day. Whereas for a wound with copiate exudate, you might instruct the patient to use silver alginate plus ABD and gauze roll and tape, change BID or even TID. In particular, make sure patients are observing if the wound is looking too wet and adjust the frequency as needed on reevaluation. Let's do a quick quiz to check our learning. Let's say we have a patient who presents with a wound that looks like this on the left. What initial wound care orders would be most appropriate? A. Calcium alginate plus border gauze. B. Silver alginate plus border foam. C. Honey gel plus ABD and gauze roll. Or or D, silver alginate plus ABD and gauze roll? I'll go ahead and give you folks a minute or so to take a look at this. All right, let's take a look at option A, calcium alginate plus border gauze. Alginate is a good option given the amount of exudate we see from this leg. However, border gauze is for dry to minimally wet wounds. B is incorrect for the same reason. Border foam would not be able to handle the drainage. C, honey gel plus ABD and gauze roll is partially correct in that the ABD and gauze roll have the most absorptive properties. However, remember honey gel is for low to moderately exudative wounds. So that leaves us with D, silver alginate plus ABD and gauze roll, both of which would be appropriate for this highly draining and likely infected wound. Last, I wanted to touch on a special situation that was mentioned earlier. For patients with dry gangrene, other than referring to vascular surgery, the dressing of choice is painting the affected area with iodine and covering with a bulky, dry gauze dressing for protection. So, to summarize, number 1, address factors of healing such as ischemia, infection, and edema, as without resolution, any amount of fancy dressings will not result in healing. Number 2, use dressings to manage drainage. Number 3, order a primary and secondary dressing. And number 4, instruct patients on frequency of dressing changes. And that is the conclusion of our brief dressings module. See you next time.